Hi, friends. I am here being joined by my younger colleague, Dr. Mainak Mukhopadhyay. He is working as Senior Interventional Cardiologist in AMRI Municipal Salt Lake branch. Mainak, can you introduce yourself, where from your journey started in the field of cardiology?
I did my DM residency from NRS Medical College. Then after I completed my 3 years post-DM bond at Midnapur Medical College, followed by I started my journey in Salt Lake MRI Hospital. Along with that, I am also attached with IIT Kharagpur as a visiting consultant cardiology.
That's great, IIT Kharagpur. So he's a brilliant guy, and today's topic is hypertension. Now, hypertension is very common and easily treatable. So for physician and for the audience who are watching us from CSI West Bengal branch podcast series, what is hypertension for common people?
Actually, around 3 to 4 decades back, when we used to talk about the health status of the Indian population, we used to talk more about the communicable diseases like pneumonia, malaria, these are the things. But after that, for the last 2 decades, we have been talking more about the non-communicable diseases like these hypertension, diabetes, coronary artery disease, these things. Now, hypertension is one of the most important modifiable risk factor for this atherosclerotic heart disease. And in India, hypertension accounts for around 10% of death, and it accounts for around 25 to 30% of all myocardial infarction and stroke also. But unfortunately, the thing is that in spite of that, almost 25% of the Indian population is hypertensive, but only 1/3 of them are still diagnosed.
Right. So, what is, the number is very important, whether it is cholesterol and whether it's hypertension, whether it's 140/90. When you call a man or woman is having hypertension, what is the number?
Actually, there are multiple guidelines, but most of the times we do follow our Indian hypertension guideline. So according to that, a person who is having blood pressure of more than 140 millimeter mercury of systolic and or diastolic blood pressure more than 90, then we should stamp him as an hypertensive patient.
Right. So there is a myth that once you are hypertensive, you have to start taking medicines. And it's not always true that you have to start medications in mild hypertension or obese hypertension, smokers. So there are some treatable causes and untreatable causes. So what are the common causes of hypertension the young generation should take care of their incidence of hypertension in the society, or they can get rid of the hypertension at young age? What are the common causes of hypertension?
So there are multiple lifestyle and dietary modifications that we can offer to our patients at the initial stage of hypertension diagnosis, like to reduce the body weight.
So that means you are saying that if you do not maintain a proper lifestyle,
Exactly.
you can be at risk of hypertension, but maybe it was delayed, but now it can surface earlier if you do not adapt to good lifestyle modifications. So like smoking or alcohol, no exercise, lack of sleep, stress, etc. What are the other causes of hypertension?
Then there can be some secondary causes of hypertension where hypertension is related to some other causes, like there can be block in the renal artery that we call renal artery stenosis. There can be block in the main artery from the heart, like the coarctation of aorta. There can be obstructive sleep apnea, which is mostly related to very high body weight and causing respiratory obstruction at night. So these are the things if we can address these things, then this hypertension can be completely cured also.
Right. So that means there are certain investigations which can tell us or can diagnose whether it is a primary hypertension or secondary hypertension, whether it's arising from your some birth defect in the aorta like coarctations or renal artery stenosis due to fibromuscular dysplasia or atherosclerotic cardiovascular disease. So investigation is very important once you are hypertensive. So the first visit when somebody is coming to you for consultation, young, old, men, women, and elderly, frail, post-CBG, post-stenting, post-pacemaker. So what are the basic investigation one should do during their health checkup if they have a propensity or a family history of hypertension, their brothers, their siblings, or their parents are suffering from hypertension? So what are the basic investigation one should do?
So apart from a good physical examination, we should concentrate on investigating a hypertensive patient because we would like to know what is the organ damage that has already done because of hypertension, like to assess the renal function, urea, creatinine, electrolytes, that assess the heart with an ECG or echocardiography, whether there is any LVH at all or not. We can go for Doppler study of the carotid arteries that can give an idea about the status of the intimomedial thickening and any atherosclerotic plaques. And apart from them, there are some sisters and brothers of hypertension like dyslipidemia, diabetes mellitus, uric acid high. So these are the all things that we should assess for with the blood tests.
Thyroid function test. Anemia should be ruled out. CKD, the kidney function should be ruled out. Now, there are certain machines are available. Like, we as a doctor check the blood pressure in the office, and patients have a habit of checking their blood pressure at home with their electronic devices. Now also ambulatory blood pressure, home monitoring, all these are available. How reliable they are, how early they should have these adoptions of these blood pressure measurement device in their home. What is the scope of increasing the drug compliance, drug efficacy, or decreasing the death rate in the community by adopting these kind of devices in the treatment of hypertension?
Now, regarding most of the times, we do check the blood pressure at our clinic only, but it is to some extent fallacious because 40 to 50% of the patients are having higher blood pressure in the clinic, but can have lower blood pressure at home. Even the reverse is also true. So these are the things that we should keep in mind, like the hypertension that is called the masked hypertension, normal BP at clinic but higher at home, can have also the white coat effect or white coat hypertension where the BP is higher at the clinic but normal at home. For these situations, it is important to check the blood pressure at home with some FDA approved validated home monitoring device. There is a home blood pressure monitoring. And in sometimes when we are much concerned about the diurnal variability of the blood pressure, like the nocturnal blood pressure, early morning surge, any sudden dip of the blood pressure, different dipping patterns, then we do advocate for this ambulatory blood pressure monitoring, which is nothing but a 24 hours continuous or episodic blood pressure monitoring at a certain interval. That gives up some graphs and we can get the idea.
Right. So it's also very important in pregnant ladies, the hypertension. You can use this ambulatory blood pressure monitoring to monitor their blood pressure. They are not supposed to come to your clinic each and every day, and these can be seen through your internet, in your mobiles. They can transmit these data. So how important is to know that during pregnancy, the incidence of hypertension, the treatment of hypertension, the consequence of hypertension during pregnancy, especially in first pregnancy or bad obstetrical history or repeat pregnancy, multiparasomia. So what is the current state of affairs of pregnancy in hypertension?
Now, hypertension is pregnancy a very important thing because it can have dismal prognosis both for the mother and also for the baby. Now, there are two parts. One, a patient who is already hypertension can have pregnancy. That is one thing. And sometimes patient can develop hypertension during pregnancy. But the problem is that many times these are the group of patients who can have some renal problems like protein leakage through urine that can culminate into preeclampsia. And again, this can again aggravate into CNS manifestation like seizures, convulsions that we call eclampsia. So these are the very life-threatening serious.
They can die even.
They can even die
with just simple hypertension, which is, is suicidal if you do not treat. So the gynecologist should have kind of referrals to you, the cardiologist or the physician, for better control at least once in their lifetime, and that should not be a routine for everybody, but those who have a high-risk pregnancy or those who have shown weight gain or albuminuria or liver function deranged, they have the protein tendency. So what are the drug options? The drug is always a best therapy for hypertension. There are drugs which can cause serious side effects. So tell me about the best drug available to treat hypertension in the community at economic, like a combination of drug, the economics of the drug, availability of the drug, and attractiveness of that particular combination. That means without side effects like leg swelling or a cough or your sexual dysfunctions, your weakness, etc. All can come due to drugs. So what is your take or what is your best strategy to prescribe a good drug for long term in patients suffering from hypertension plus minus other diseases like obstructive sleep apnea, post-CABG, post-statin. So what's your take on drug combinations or available drug in our country?
Now, nowadays there are multiple drugs available for hypertension treatment in India. Almost all the drugs are available. But there are different categories like diuretics, angiotensin receptor blockers, angiotensin enzyme inhibitors, mineralocorticoid receptor antagonists, calcium channel blockers, beta blockers, direct vasodilators. Now, each and every drug has its own pros and cons. So the treatment should be individualized. The most important thing is that we will have to decrease the number and to reach the targets, whatever be the drug we use. But there are definitely some molecules has got some added advantage for the organ protection, like these ACE inhibitors or ARBs, the receptor blockers. They have got some ample data that they can prevent the diabetes development also. They can prevent and can cure some cardiac issues like heart failure, atherosclerotic heart disease. They have got good data. So that we should keep in mind.
Fantastic. That means this drug juggler is important, the compliance is important, patient's preference is important. There should be time spent between the patient's relatives, the patient himself, and the physicians in the office hours. And the first visit is very important. And during that day, that particular few minutes or few moments, they wanted to know so many things about the diet, their lifestyle. And it's a team effort. Like in our chamber, we appointed dietitians, their weight management, the diabetic medications, the drug list, polypharmacy, the side effect, all should be described in a proper manner to each and every patient. But unfortunately, we do not get so much of time to explain, but subsequent visit, the things which you have missed can be corrected. So what are the difficulties you face to treat even a simple hypertension in day-to-day practice?
So probably the drug compliance, because most of the patients has a notion that once the BP is controlled, then they can stop the medicine. It can cause the death to the patient also. That can lead to hemorrhagic stroke and others. So this compliance is very important. All the patients, even after a good control of blood pressure, should continue their medicines regularly as per prescription of the doctor. Then again, some cost issues and other side effect issues of different medicines. Each and every medicine has got its own side effects. So the treatment has to be individualized with regular follow-up and different.
Right. So in the follow-up, so what are the minimum tests one should do to avoid the serious complications, like somebody who is on diabetics, they can suffer from very low sodium, their potassium level can go down, the uric acid level goes up. So how frequently this health checkup or the monitoring should be done in hypertensive patient, young, elderly? So how frequently they should visit?
So any drug, when we starts its action something around 2 weeks and almost reach the peak within around 4 to 6 weeks of its initiation. So at the initial follow-up, I always recommend my patient to come again after 4 to 6 weeks. Then once the BP is controlled, then we can keep the follow-up for around every 3 to 6 months, depending upon the patient's.
Right. So there are multiple drugs. Now there are new devices, renal denervations, like an operation for angioplasty. But once you are hypertensive, it's always preferable to visit physicians and continue drugs, not to stop all these drugs because of side effects. If you have side effects, you can always change the group of medication from A to B, B to C, or small dose of A or small dose of B. These are called combination pill. And there are different Indian pharmaceutical companies. They are providing this kind of therapeutics at very reasonable cost. So we are almost coming to the end of our discussions. The hypertension is very important. It does reduce the incidence of stroke, does reduce the incidence of heart failure, sudden cardiac death, and kidney damage, so on and so forth. And we are Indians sitting here suffering from higher incidence of hypertension and diabetes because of lack of exercise, professional stress, the pollution, etc. So what is a common citizen or a citizen of India need to do from their end to change the society or the perception of hypertension or change the environment? What should be a role or a hero or a heroine or actor or actress, politicians, the philosopher, the scientist of a society, affluent society, progressive society should do or think to reduce the hypertension, a menace in the society?
So the best statement should be know your number and know your risk factors. This is the thing. Each and every person should know his own blood pressure, and even if it is normal, they should at least check it every
No,
year.
what I'm
at
saying,
least.
what is the role of a common citizen to change the whole gamut or the whole incidence of hypertension and complications? What is their role? I mean, we are talking about our role to the patients. We are talking about patients' role to the physicians. What is the role of a government or the politicians or the thought leaders or the influencers, the buddhijivis, to treat or to reduce the burden of hypertension in the country?
So better detection of the hypertension through hypertension clinics, which India government has already started, and they are picking up the hypertensive patients early and treating them with the common medicines, particularly telmisartan and amlodipine combinations. So better diagnosis and better control, and also to promote the lifestyle modification and a better health habits.
Right. So, thank you, friends. We have come almost to the end of our podcast series, and what we have learned from Mainak today, that hypertension is very important. Lifestyle modifications, yoga, which can change your gene, modify your gene. The pollution level in the country, the vehicle or non-vehicular pollutions to the atmosphere, a less stressful life, a job stress, professional stress, some kind of exercise in working place like doing a treadmill, good sleep or sleep in between a stressful hours, relaxations, medications, renal innervations, continue medication for lifelong can give you a prolonged life and complication-free life, stroke-free life, heart attack-free life, heart failure-free life. So it can add life to years and years to your life. Thank you very much, Mainak, for joining us. Thank you very much.